Hi, everybody. It's my great pleasure to welcome you all to the virtual launch of our 7th report on lung cancer, which is the challenges in the care pathway and preferences of people with lung cancer in Europe. So thank you all so much for joining us today. And before we kick off, I just have a couple of housekeeping notes. We would ask that you keep yourself on mute with your cameras off. For those wishing to ask a question, at the bottom of the screen, you will see a little kind of chat bubble with Q&A, so you can type in your questions there, and then we can answer them at the end of the session when we come to the Q&A session. And Alfonso, as always, is in mission control, so I'll ask you to just go to the next slide, please. So today we have a fairly packed agenda, which is going to include an EU perspective on lung cancer, followed by, I guess, a top-line overview of the 7th LuCE report. And then we will have both the patient perspective of the care pathway as well as a healthcare perspective on the care pathway as well. Then we're going to have a short video with some closing remarks, followed by the Q&A session. And then we will have a brief summary of the report and our call to action, and then the meeting close. At the end of this event, all of the materials associated with the report will be available on our website, and we will give you more information on that as we close out the meeting. So on behalf of Lung Cancer Europe, I would like to extend my gratitude to MEP Tomislav Sokol, who is hosting us virtually for our event. And I know you're extremely busy, Mr. Sokol, so I will now, without further ado, hand over to you to kick us off for our event. And thank you so much for being with us and hosting us today.
Thank you very much. Hello to everybody. I'm glad that I'm able to host this event, because I think lung cancer is extremely important, one of the biggest killers in terms of mortality of different types of cancers. And I think that now on the EU level we really have the possibility to do a lot more than we've done before to combat this type of cancer and cancer in general. As you know, healthcare is primarily a national competence, so financing, organization, and management of healthcare primarily belong to national autonomy, which means that European possibilities to act are very limited. However, this should not be an excuse not to do anything on European level. And definitely what the last several years have shown us, that European dimension in battling cancer and in healthcare in general is very important, and that there are many issues which member states cannot resolve by themselves. When we speak of healthcare, unfortunately, healthcare has traditionally been a marginal policy in the EU, but this has changed. And I believe the reason why this has changed in the last couple of years are due to two things. One is obviously COVID-19. I don't have to explain this. But the second, the most important European initiative in the area of healthcare is the Europe's Beating Cancer Plan. So adoption of the Europe's Beating Cancer Plan, which was already initiated during the 2019 electoral campaign, when Manfred Weber, chairman of EPP, my political group in the European Parliament, is something which is very important, and it has really pushed the ambitions of European Union much higher in terms of healthcare and battling cancer. Why is Europe's Beating Cancer Plan so important? Because it is the first plan, first strategy, let's say, which provides such a systematic approach, such an overall approach, that it covers every phase of fighting against cancer. So it includes research, it includes early detection, which is very important for screening. You will be discussing this today, prevention, treatment, and afterlife of cancer survivors. So all of these phases are included. So that's the first big added value of the Europe's Beating Cancer Plan. The second, very important dimension is the fact that here we just don't have a strategy like a big wish list, but we actually have concrete measures, concrete timetables, action plan, benchmarks, indicators, and very strong funding of more than 4 billion euros. So I think this is something extremely important, that we have this plan, that we have this European dimension now much strengthened in terms of beating cancer. Of course, the plan is not perfect, and I think the main problem, let's say, with the plan is that it's not completely balanced. So some areas, especially early prevention research and early detection, prevention, and research, are very strongly emphasized with strong concrete measures. Well, for instance, treatment is not that concrete. The provisions of the treatment are not that concrete, and this is why the European Parliament, in its report on Europe's beating cancer plan, proposed certain recommendations and suggestions how to improve the plan and the implementation of the plan. When you go to concrete phases, of course, first is research and innovation. Here, the most important fact is that beating cancer has become one of the priority missions of Horizon program. You know that Horizon program is the top European program for funding excellent scientific research, and here now healthcare has become one of the priorities, and in general, but also beating cancer specifically has become one of the flagship missions of the Horizon program, which means that much more funding from the new Horizon will be dedicated to research on cancer, and this is definitely a very big achievement on our part. The second important thing is prevention. Prevention is important because in the area of prevention, actually, European Union has the strongest role to play. So here, European Union has the strongest powers, and here in the area of prevention, we already actually have concrete European measures in areas of tobacco, smoking, of alcohol, etc. We just need to be updated so that we can strengthen the fight against cancer. Here, as you all know, around 40% of cases of cancer are preventable, which means that prevention has to become one of the strongest policies that we have at our disposal to beat cancer. And of course, prevention is probably the most cost-effective tool in beating cancer, because you can achieve the biggest results with the least amount of money invested. When we speak of concrete measures in the area of prevention, the Commission is coming up with new proposals on tobacco advertising, on taxation of tobacco, also of alcohol. These are just some areas, but also there will be special rules on chemicals, etc., which will definitely go in favor of really trying to fight these underlying causes of cancer, especially smoking. So we have the European Union rules on indirect taxes, on excise duties, which will be heightened, which will be made higher in order to reduce the use of tobacco in the coming years. Of course, what is also important here is that we also take into account alternatives like e-cigarettes, etc., that they have also the role to play, but we will see how this will play out in the end. On early detection, that is something which I think is very important. So we will have a strong European financial support for screening, especially for types of screening of certain types of cancer where we have the target of 90% screening of target groups, for instance, for breast and cervical cancers, but there will be also strong support, as we saw in the latest recommendations, for screening of other types of cancer, especially when we speak of lung cancers for smokers and ex-smokers between the age of 50 and 75, which I think is also very important. Here, I would like to stress that the European Union is providing financial support for these programs, which will be conducted, obviously, on the national level. And one of the biggest sources of funding is EU for Health program. And I would just like to mention that EU for Health program is something that the European Parliament has fought very hard on. So we fought very hard on strengthening the EU budget for health, and because of this, now we have this new EU for Health program, new budgetary program for healthcare, which is 12 times bigger actually than it was the previous European Union budgetary program in the period from 2014 to 2020. So in the period from 2014 to 2020, we had around 450 million euros at our disposal in EU budgetary program for healthcare. But now in the period 2021 to 2027, we have 5.3 billion euros. which is a big win for the Parliament. But Parliament also wanted more. Parliament wanted more than 9 billion euros, but the member states in the Council didn't want this. So the final compromise was reached at the level of 5.3 billion euros, which is still a big success because a lot of this funding will actually go to fund the programs on beating cancer. On the treatment, as I said, I think here the plan is the least precise and weakest in terms of concrete measures. It does identify a big problem, a major issue, which I think is the biggest problem in terms of healthcare provision in Europe in general, and that is inequalities. So inequalities in terms of access to healthcare, in terms of healthcare standards, in terms of funding, in terms of infrastructure, workforce, which is a big problem, especially in Central and Eastern European member states, like my member state, Croatia. So the program identifies this as the major issue. It provides for certain measures, like developing European Cancer Inequalities Registry, but we believe that it is not enough. And this is why in our report in the European Parliament of the Special Committee on Beating Cancer, we emphasize the need for more investments, especially into health infrastructure and health workforce in less developed parts of the EU, also in rural areas, which are definitely suffering from a lack of adequate healthcare, especially when compared to major cities. And this is something which is very important. Also, we emphasized one area where I think there is a room for a lot of progress, and that is cross-border healthcare. So currently we have EU legal framework on cross-border healthcare, which aims to facilitate access to healthcare for patients who cannot get adequate treatment, including also for lung cancer, in their own home country. Unfortunately, this European legal framework is much too complicated, very bureaucratic. It lasts, these prior authorization and reimbursement decisions on this cross-border healthcare last a long time. And these rules are so complicated that not even health lawyers sometimes are able to find their way through them. So we think we need to change that. So this is why the Parliament proposed actually to simplify these rules. Currently, we have two sets of rules which regulate cross-border healthcare: the Cross-Border Healthcare Directive and the Social Security Coordination Regulation. So we propose to merge these reimbursement rules into one legal instrument to make it simpler, to make it easier, but also to provide additional information to patients who want to access healthcare abroad, because unfortunately not many patients are aware of this possibility at all. So this is the first thing that we propose on cross-border healthcare. So to simplify rules, to provide additional information to patients, and also to provide the right to so-called second opinion. So why? Because when making decisions on whether to grant authorization for patients to go abroad to get healthcare, in many cases only domestic experts in the member state in which the patient is insured are included in this decision-making process. And in many cases, the experts are maybe just not aware of the other, maybe better and more effective treatment which are provided in other member states. So this is why the Parliament has proposed to use European reference networks, which already exist, networks of excellence of healthcare experts, so that best European experts can provide the second opinion on where and the information on where is the best possible treatment available in the European Union for patients who cannot get adequate treatment in their own home country. So these are some concrete things that we proposed. And also in the end on cancer survivors, that is also very important. But what is important for the Parliament is to implement the so-called right to be forgotten. So what happens in practice in many member states is that cancer survivors suffer discrimination, that they pay higher premiums for life insurance, for instance, and this is something which is unacceptable for us, this kind of discrimination. Some member states prohibit this after a period of 5 to 10 years where health data cannot be asked when determining premiums for insurance, but this is only regulated in some member states, in some not. So what we are proposing now to do on the European level, what the Parliament proposes is to adopt common European rules which will prohibit discrimination of cancer survivors in the entire European Union. And we propose to do this via concrete legislative framework. So the Commission proposed the code of conduct. We think that this is not enough. but that we need a concrete European legislation to regulate this and to prohibit discrimination of cancer survivors. So this is more or less it what I wanted to say. I think that Europe's Beating Cancer Plan is a real breakthrough, is a real game changer. It can also provide a blueprint for strategies for other types of non-communicable diseases as well, and strengthen European role into this. I think that its biggest added value is that it is systematic, that it covers all the phases of fight against cancer. Early detection, including screening, is one of the most important priorities of this plan. It provides concrete European funding to support these programs, which I think will be one of the main added values and one of the biggest advantages of this plan. And also what is important in the future is also to recognize the problem of healthcare inequalities and to strengthen even further the fight against healthcare inequalities in the area of cancer, so that all European citizens can get adequate health treatment on the same level in the entire European Union. And this is something that I personally will be fighting for. So thank you again very much for reaching out. I'm glad to host this event. I'm sorry I cannot stay longer, but you can understand that it is a very, very, very busy time now before Christmas in the European institutions. But I look forward to get the follow-up input, the follow-up output of this event, and continue to work closely together to strengthen European role in beating cancer. Thank you very much.
Thank you so much, Mr. Sokol, for kicking off our event and for those great comments. And we also really appreciate the great work that you're doing as a member of the MEP Lung Health Group, as well as the Special Committee on Beating Cancer. It's so great to hear about cancer being a priority on the EU health agenda, although we do understand, given that health is an individual country competency, this can lead to difficulties within and across European countries. But of course, the funding programs you're talking around Horizon and flagship missions, it's great to see funding going into cancer research, and hopefully that'll be evenly distributed so that lung cancer won't be missed within that. It's also very important as you talk about the risk reduction and more research in that area. And I think for lung in particular, it's very important that this is looked at in a very holistic way, because we know smoking is a very heavy addiction, and it can be very difficult for people to reduce their use or to quit their use. So we need to understand that we have to take a very empathetic approach and be very understanding of that addiction.
And if I may just add one thing that I forgot, one
of
important
course.
flagship initiatives, which is also part of the plan, is European health data space. And I'm the European Parliament's rapporteur on this. So the idea is to create one common European space in which health data could be exchanged and used in different member states, and to create this electronic health record and the electronic health record exchange format, which will make it possible for healthcare professionals to access health data of patients from different member states. So, for instance, if you are traveling and studying in another member state, and you go to see a doctor, that this doctor can get all of your health data, the important health data, without having to go through additional new diagnostics and examinations, etc. So this is very important to increase the use of data for primary use, but also for secondary use, also to facilitate the use of health data for research and innovation. So this is probably the most important concrete legislative proposal that we have on healthcare at the moment in the European Union, which will also affect fight against cancer as well. And I'm glad that I have been appointed rapporteur on this, because we have to strengthen and facilitate the use of health data across Europe. And this is something that I will be fighting on as the rapporteur of the European Parliament.
Yeah, absolutely. And that will help as well in terms of access to different treatments too. So it's great to see so much happening within the space. And you also touched upon screening and these new updated EU Council recommendations that are coming. So we really hope that the language is strong around lung cancer screening, because really it's going to be key in getting that stage shift from the late diagnosis that we're seeing at the moment to early stage disease, where we know outcomes are better. And hopefully as well, that'll be in a sense, a way to tackle inequality so that everyone has access, irrespective of their location or their socioeconomic situation. So thank you so much again, Mr. Sokol. We really, really appreciate your support of our event. And we know you're extremely busy with everything going on, and I know you can't stay with us. So we'll just continue now, and obviously we will follow up and share all of the report materials with you when they're launched at the end of this meeting. So thank you so much again.
Thank you. Bye-bye.
Bye. So on to the next item on the agenda. So I'm afraid you're stuck with me. I am the next speaker. So Alfonso, back to you in mission control, just to do the slides. And everyone who knows me knows that I am a fan of animation. So again, apologies in advance, Alfonso, on changing slides for me and things like that. So it falls to me to give you a very kind of brief overview of the report, because this report is very detailed. It is an awful lot of information, and within the time frame, it would just be impossible to go into absolutely everything. So I'm hoping to give you a bit of a snapshot and a bit of a flavor of the huge amount of work that went into this report and the data that has come out of it. So for those of you who are not so aware of Lung Cancer Europe, I just wanted to have a couple of slides at the beginning to say a little bit about the organisation and what we do. So LuCE is a pan-European organisation, and our vision is that all Europeans who are impacted by lung cancer will have equity and access to optimal care so that they have the best possible outcomes and quality of life. So you can see within our vision already, this is a very broad statement and will include all points within the care pathway. Next slide, please. So our mission is really to be the voice of Europeans impacted by lung cancer. Our mission is to collaborate with any stakeholder within the lung community or further afield, and to work together to not only help to improve outcomes through best possible care, but also to work on destigmatizing the disease, because stigma is a big issue still in lung cancer. And of course, being a pan-European organisation, part of our mission is to empower our members to ensure a strong and effective lung cancer patient advocacy voice across Europe. Next slide, please, Alfonso. And our core purpose linked into our vision and mission really breaks down into 4 different areas, and that's around representing, strengthening, acting and amplifying. And all of these core purposes feed into doing work which are going to help to improve outcomes or do things for the European lung cancer community. So with that very brief snapshot of the organisation, I'm now going to go into the report itself and give you a flavour of it. So Alfonso, next slide, please. Oh, membership, apologies. Here is an update on our membership. So we currently have 38 members, which are a mix of full members and associate and individual members. And that's now 23 countries represented in Europe. But of course, all of the time we are working to increase our reach within Europe to ensure more countries are represented in what we do. So I think my next slide is the start of the report. Yes, there we go. Thank you, Alfonso. So the aims of this report, we had 3 key aims. The first one was around exploring the experiences of people diagnosed with lung cancer. And this is from disease presentation through to diagnosis, to treatment and to follow-up. The second aim, if you just click again, Alfonso, was to identify any barriers that people might have come across and areas that would need improvement to enhance the care pathway. And the third point was to obtain preliminary data to explore specific challenges in the lung cancer care pathway. And we did a sort of small case study in 2 countries, the Netherlands and Romania. But unfortunately, in the interest of time, I really can't touch upon that in this presentation, but all of the information will be available on the website at the end of this report launch. Next slide, please, Alfonso. So in terms of the methodology, there was an extensive literature review undertaken, which of course feeds into not only the scope of the report, but also inputs into the survey design, which was the next part of the methodology. So if you just click again, Alfonso. And just once more, please. Thank you. Brilliant. We had a working group that came together under the direction of myself as working group chair and Diego Vallon as well. And working with our working group, we developed an online survey and then worked on the questions around that and also the dissemination, which went out in about 17 European languages. And of course, then the data analysis as well. So this year we've had the most responses we've ever had to one of our surveys, and that was 991 participants. So thanks to everybody who partook in this or disseminated it in any way. Next slide, please. So now for a brief overview of the characteristics, so you can click. Thanks so much, Alfonso. The majority were female, so about 70% were female, which is in line with other years. But of course, we need to do better getting more men who are going to participate in this. The majority of respondents were between 55 and 64 years of age. The majority were also diagnosed with non-small cell lung cancer, with adenocarcinoma being the main subtype. And then when we looked at some of the molecular markers, about 20% of people who responded had an ALK positive non-small cell adenocarcinoma. And I guess not unexpected in a survey of this kind, over half of those who responded had stage 4 disease. Next slide, please, Alfonso. So following on from that, there was responses from 25 European countries, but of course the response numbers varied among countries. But those with the most respondents came from France, Germany, the UK, Poland, Greece, Spain, and then Italy. In terms of where people were living, about half of our respondents were in an urban area and then followed by rural and suburban. And in terms of education, about 43% had a tertiary education and then about 36% had upper secondary education. So that's just a very brief snapshot of participant characteristics. Next slide, please, Alfonso. So we've broken it into a number of different points along the care pathway. So the first one I'm going to talk about is the diagnostic pathway. And the first thing we want to draw your attention to is time intervals within the diagnostic pathway. And here in the little red circles, you can see the percentage of people who waited for more than a month to be seen at those different points. So a large number, 40%, there was waiting from first symptoms to going to their doctor. We also see that there was delays in terms of getting primary healthcare appointments, seeing a lung cancer specialist, and also in terms of the lung cancer diagnosis in and of itself. And very worryingly as well, we are also seeing significant delays from the point of diagnosis to the start of treatment as well. So as you can see already within the diagnostic pathway, there are a number of different issues where we are seeing delays. Next, Alfonso. From the survey responses, there was a number of priorities that our participants felt would help to improve the diagnostic pathway. And that was really around fast tracking services, providing a point of contact from the healthcare team, because it can be very overwhelming. And if you have questions, who can I contact? When can I contact them? And also because the lung cancer pathway is getting much more complicated, it's really important to have a clear roadmap and clear information. And a lot of the items that also came up was around communication, around empathy and sensitivity, around clarity of the messaging, and then also around the educational and information needs as well. Next, please. So when we asked about what would be needed to obtain an earlier diagnosis, it is really no shock that we see that 64% feel that we need to have the implementation of screening programs, but also around education for primary care doctors, the shortening of the waiting times, and of course, education for the public around lung cancer as well. Next, please, Alfonso. When we continue then to look at the treatment pathway, there was a lot of issues around information, treatment decision-making, and communication. So I think throughout this, you'll see that communication comes up time and time again. So this is something that needs to be improved upon. we had a couple of questions around informed consent and the informed consent process. And it was really, really very worrying that only about half of those that participated in our survey felt that they received all of the information that they needed before signing an informed consent document. We really, really need to be doing much, much better here. And when it came to how we could look at improving this process, it is really around the language and the communication again. So you're talking about lay language. Is it actually lay language, or is it someone who thinks they're writing in lay language? And also having that time for having conversations with specialists to better understand the informed consent process. Next, please, Alfonso. So again, information is key, and it's going to come up time and time again. But when we look at treatment decision making, it's really information needs around three key things. What is available to me? What do I have access to? What are the advantages and disadvantages of the treatment options? And what are the potential side effects and risks that I might be facing if I take this particular treatment? So a lot to be done within those areas. Next, Alfonso. And then when we also looked at it in terms of what type of information was needed or were missed, a lot of it was around clinical trials, emotional, social issues, advanced care planning, so end-of-life planning, around managing the side effects and treatment effects of lung cancer, and again, the rapid access to healthcare services when needed. And worryingly as well, but I guess maybe not as a surprise, when we asked about communicating with the healthcare team, about half of our participants stated that they've not shared all aspects of their health status with their healthcare team. So again, areas that have to be worked upon. Next, please, Alfonso. When we looked at it in terms of supportive care, because supportive care is a big part of the pathway as well, about 35% recognized their overall needs were not addressed. And this was really around emotional, physical, and social issues. Next, please, Alfonso. And when we looked at what was kind of the most difficult things to manage within the treatment pathway, a lot of it revolved in terms of surgery around being very anxious before the surgery, the pain associated with it. When we looked at radiotherapy, it was around weakness, fatigue, stress, and anxiety. And then when we looked at pharmacotherapy, it again was around that weakness, fatigue, nausea, and vomiting, and the different effects that are associated with all of the different treatment modalities. Next, please, Alfonso. When we looked at priorities during and after treatment, it was really all around reducing the risk of complications, being able to support themselves and getting help from others around side effect management, and pain management was something that really stood out. And it doesn't seem that for a lot of people that's been appropriately managed. And of course, as well as that, it's around the needs where you might have to go to an allied healthcare professional, maybe a physiotherapist or a dietitian or something like that. Really important to have education around self-manage. What can I do myself to help me manage my disease and side effects better? And then, of course, what has come up in a number of different sections across this is the improvement of the accessibility to the medical and nursing team is also really, really important. Next, please, Alfonso. And as well as that, when we looked around communication, a lot of them felt that healthcare teams need to be informing people about supportive services before the start of treatment. So I guess by this, it's not something that's like an added on extra kind of luxury. It's something that should be there from the get-go and explained what is available, and ways in which communication might be improved is nurse specialists in lung cancer and having access to them, and as well as having more time to talk to your medical consultant or even your care team as well. Next slide, please, Alfonso. And just a little bit of additional information around the supportive care needs. And this is really reflecting what I've shown on my previous slide. but it really is around the better communication skills and having a central point of contact. So I did feel that we needed to stress that, because it's really, really important that if someone has a worry or a concern, that they know that they have someone that they can contact when they can contact them, and they know that this person is easy to communicate, so that they can talk about maybe their fears or worries or side effects or whatever it might be. Next slide, please, Alfonso. When we then looked at it in terms of follow-up care, again, about 31% were not satisfied with the support care that they received as part of follow-up care, and follow-up care is really, really important. It shouldn't be something that's overlooked in the pathway. And about 85% of participants who had completed their active treatment felt that they still missed a lot of information and support in that follow-up care part of their care pathway. And again, there was a number of different priorities that were identified that could have helped, and things that they missed the most. So really, again, it comes around to information needs, around particularly in terms of the worry around recurrence, helping to manage that long-term consequences of the disease itself and the treatment. Again, that connection with the healthcare team and having rapid access to them when it's needed. And then making sure that whatever the follow-up care plan, it is in the overall care plan, so that people know what to expect or what might be the next thing. And of course, again, no shock, I think, to anybody within our community. It really is psychosocial supports are really needed. And this has come out time and time again in the research that we've done. So Alfonso, if you go to the next one. So I think, and I'm sorry, I know that was quite a short whistle-stop tour of the report, but I hope that provides a snapshot showing some of the key issues and concerns within the care pathway. And I think it's very clear to see that communication, information needs, and that in terms of communicating with the healthcare team, having someone you can talk to, and all of those things could make a huge difference to people's experiences within the care pathway. So you'll be glad to know that I'm going to stop talking now, and I'm going to pass over to our next speaker. So I'm very pleased to welcome Nicolene Earhart. Nicolene is a patient advocate, and she is from ALK Positive Deutschland. Probably have not pronounced that very well. She is a mediator and coach, and a patient and lung cancer advocate with a focus on Germany and Europe. She is a co-founder and board member of ALK Positive Europe, a co-founder of ALK Positive Deutschland, and a board member of Zeigenu. Again, Nicolene, probably not doing that word justice, so I do apologize. And Nicolene also works as part of these teams to sustainably improve outcomes and quality of life for people living with ALK positive lung cancer. So I'll pass over to you, Nicolene, and thank you so much for being here with us today.
Thank you very much, Anne-Marie, and your German was nearly perfect. Yeah, I just want to tell you a little bit about my way to my lung cancer diagnosis, and part of this is also, of course, that I am a patient advocate, and have a lot of experiences through all the patients I'm working with. And at the beginning of my diagnosis, there were two problems. First of all, there was stigma, but with the opposite effect. In my case, I'm a non-smoker. Doctors were not aware that non-smokers with no risk factors could get lung cancer. Therefore, they thought of allergies and asthma and all those things. And there was no pressure for them to look deeply into my symptoms. And so over here in Germany, there's still a huge lack of awareness among GPs about the possibility of lung cancer, even more if there are no risk factors. And we need an extensive awareness raising, especially among GPs, so that they also can get the idea that non-smokers are in risk for lung cancer. The other thing was the in Germany, you sometimes have long waiting times for appointments with a doctor. With GP appointments, this is pretty easy. You can get them within 1 to 2 weeks. But when you need a specialist like a pulmonologist, it could last up to 3 months. This is really common. In my case, it was 3 months until I saw a pulmonologist. And so from my persistent cough to my diagnosis, it was 9 months. And in this long waiting time, this results often a metastatic disease. Most ALK patients, for example, because they don't have any known risk factors, are diagnosed with stage 4 lung cancer. And this is something we probably, or we for sure, not probably, we for sure have to change. Another important thing on my way as a lung cancer patient was information. When I was first diagnosed 5 years ago, no one mentioned even the word biomarker. So I had no idea which term I could search on the internet, for example. Today, biomarker testing is much more widely discussed with patients. But however, how many patients are still poorly informed about the topic, and this is the most important thing about this, its impact on their upcoming treatment. If you don't know how crucial it is, you can't ask for it, you can't think about treatment options. This is a real problem we have. In Germany, the testing rates are only a good 80%. Of course, you could say, yeah, this is pretty much compared to other countries. But this means that still every fifth lung cancer patient is not tested, and this is way too much. And another problem for us as patients is that lung cancer, that biomarker testing is not clearly regulated. So they don't have regulated quality standards for testing. If people are diagnosed, or if there is the idea that they could become diagnosed with lung cancer, they need information about everything. They need information about the diagnostic pathway. They need information about upcoming treatments. And if they don't have all those information, there's no way that they could take part in shared decision making with their doctor. And so this even will not happen. As a patient, you therefore have to be really stubborn and insist that you can really ask all your questions and that they, of course, are answered. I am such a stubborn person, but what if you are a more shy person or you are not feeling well at all? So you don't get any information and you don't know if this treatment you're on is the right treatment for you. Information is so crucial, and information is something patients need through their whole cancer journey. For example, if there's a lack of information about side effects and especially how to deal with them, you are in a really bad situation. So obviously there is not enough information about side effects given from a doctor to a patient, because the side effect management is one of the most important topics in all support groups I know. In general, patients don't have a permanent contact person. So medical staff often complains about patients using Dr. Google, but who should the patient turn to in the acute case of a side effect appearing, if they have to wait weeks until they could see the doctor to talk about the side effect? So they looked up Dr. Google, or they asked in their support group. In ALK-positive Germany, we experience almost daily how side effects could cause real anxiety, especially for newly diagnosed patients. And if you have this lack of a contact person and you don't know whom to ask, this leads to something I call it the "I don't want to complain, after all I'm still alive" syndrome. And this is something which shouldn't happen, of course. Well-being, in a way, quality of life is so important for a patient. So we need more information about side effects. And in our support group, we also experience quite often that people complain that their doctors are not talking to them about the possibility of participating in a clinical trial. So patients, even, of course, especially if they are at the end of their treatment options, want to take part in clinical trial, but it's not easy for them to find a clinical trial which suits them, to understand the description of the trial and so on. And so they need their doctors. And I know of cases or even where doctors talk their patients not to participate in a trial because they think it doesn't make any sense. And so you see, this is all about information. And I think besides all the other things who I absolutely could relate to, is information, and an informed patient is essential for a long life on your treatment, and for also the mental health being. So I hope that we have the situation one day that there is proper biomarker testing, that there are the right treatment decisions, and of course that there's enough information for patients so that they could feel safe with their treatment. Thank you.
Thank you so much, Nicolene, for sharing that. And I mean, oh my goodness, 9 months, like that, I can only imagine the emotions, the stress, the worry, all of everything that comes from with that. And I mean, I'm struggling to find the words here. I mean, like, it has to be better. You know, people who are symptomatic, people who need to get checked out cannot be waiting 9 months to get a diagnosis. And I think as well as that, like, all of the things that you've spoken about there, it really is the key areas around information, support, the importance of communication, and the importance of having that contact person so that you can have a chat with them. And I think, you know, you mentioned as well around clinical trials, I think sometimes there can be a little bit of a bias from some clinicians, and maybe they're making the decision rather than allowing the person to make the decision. And, you know, you've also talked about the biomarker testing, so that precision medicine side of things, the personalized medicine, the shared decision making. And I think one of the things we fall into in a community is when these words are being used all the time, everyone assumes that it's a real life situation. But for a lot of people, it is not. It's words that are being used, but are not being translated into the clinical setting. And of course, shared decision making is so important, and the whole thing around side effect management as well. So there's a huge amount to take away from that, and I think a lot of different points that people can work on, both from patient advocacy organizations as well as the clinical and industry side as well. So thank you so much again for being here with us and for sharing your experience with us, Nicolene. We really, really appreciate it. Thank you so very much. We're now going to move on to our next speaker, who is going to give a healthcare perspective of the care pathway. And it's my pleasure to introduce Christine Bijbak, a nurse consultant from Universitaire Ziekenhuis Ghent. Again, apologies if I have really not pronounced that very well. You'll have to bear with me. And Christine is a nurse consultant. Throughout her career, she's been interested in working with people with lung cancer, how the pathway affects them and their caregivers and loved ones, working towards improving quality of life and providing a feeling of well-being during treatment and follow-up, which I know, Christine, you believe is very, very important. And throughout the work that Christine does, she supports all of these different aspects for people going through the care pathway. So thank you so much for being with us today, Christine, and I'll hand over to you now for your presentation.
Thank you very much for the invitation. In response to the previous presentations who were very interested, I am happy to highlight my role as nurse consultant for lung cancer patients. Next slide, please. With the increase in use of therapies, immunotherapy, targeted therapy, radio, chemo combinations, chemoradiation, and the increase of the numbers of lung cancer patients and the workload of physicians, you will see there is really a need for a nurse consultants. Yes, please, the new slide. I will highlight my job description. We offer direct patient care. We guide and support the patient during the whole disease trajectory. This from diagnosis over treatment to aftercare. During 3 times a week, we have in the morning a nurse consultation hour. It's in a room near the doctors. So when we have a problem, an extra problem, we can call the physicians. We are also trainer and mentor across department. We share our knowledge and expertise to nursing and at the bedside. We recognize training needs internal and external. I'm also the president of a thoracic nursing work group from Flanders, a department of Belgium. And we organize every year a masterclass with different topics on medical topics or psychosocial topics on lung cancer. We promote expertise and continue upgrade our knowledge. We have also the opportunity to attend several meetings, conferences like ELCC, ASCO, and so we can upgrade our knowledge. And I'm also, I was forgotten it, the founder of a patient association, Prolong. We had 3 times yet an activity. In the morning, it was for 4 hours. It was information about a medical topic and a psychosocial topic. And we see that patients are very interested. And then we end with a lunch, so patients have the opportunity to meet each other, to speak to each other, and it was really a good success. So I will develop this certainly further on. Next slide, please. So I told yet we have a nursing consultation hour. It's an outpatient or telephone-based appointment with support from us. We guide the patient, also the loved ones, the family, during diagnosis, treatment, and aftercare. Next slide, please. The content of our hour is we offer individual patient care. Every person is unique. We give information and awareness about the therapy. About the possible side effects. We give brochures and materials. We give psychosocial support, or we refer to a psychologist if it's necessary. We stimulate the empowerment of the patient, so we make the patient stronger so he can manage his illness and his therapy. We do pain management. We recognize and refer. Sometimes it's necessary to a nutrition team, to the social assistant for administrative information, for assurances, and so. We plan advanced care. We phone the home situation, and we share the disease, the information about the disease. We are really direct file to the whole trajectory. Next slide, please. So we give information with anticipating what does the patient want to know. We limit also the emotions. Very important that patients express their feelings, that they give words at their anxiousness, their fear, what's really normal. But we reach also coping mechanism little by little to manage their illness, to find a way to go through their life as comfortable as possible and to live their life further on. So we recognize the emotion and we normalize the emotion. It's normal when you get just your diagnosis that you're in shock, that you're stressed, but little by little by therapy, it's necessary that you can manage these emotions and that you find a way to live as comfortable as possible through life. We guide also the human being in the patient, also very important that we don't see only the illness, the disease. There is also a person after the disease. So very important that we have an eye for the well-being of the patient. And I mentioned yet we support self-efficacy so that he can be confidential to his therapy. We have a signal and referral function. We filter what's for a nutrition team, what's for a social assistant, and we conduct the whole setting. We are also more accessible than a physician because of a nurse is more easy to talk with. Next slide, please. The way to go, very important that we have a positive attitude, even from the patient and the relatives as from the nurse consultant. It's normal that we make the patient physical fit with the therapy, that they had the opportunity to control and accept their emotions. And I mentioned yet it's important to provide coping mechanism to live their life further on. The positive attitude from the nurse consultant with a holistic vision. It's also very important that we have eye for the person in the totality, also for the spiritual dimension, for the social dimension, not only the physical, the illness. We do it interpersonal, individual, every person is unique. And also important that we have respect for the diversity between the cultural setting, dus the different norms and values from the cultural settings. Next slide, please. The content of our nursing consultation, it's different. Is it immediately after diagnosis? It's from therapy. From a new diagnosis, it's following the doctor's consultation. It takes half an hour, an hour. We offer emotional support. We are there. We attend with the patients. We answer questions. What do the patient want as information? Not to give too much information at once, because the patient assimilate not everything. It's known that the patient only assimilate 30% of the information. We repeat the diagnosis in accessible language and simple language, and also we speak about the treatment plan. We give welcome brochures, our many way from working. We present the multidisciplinary team. Patients get an information map with info and possible adverse events about the chemo, the immuno, the targeted therapy. We give a visit card and reachable phone numbers. Very important also when patient have a problem that he phone and that he is not number 7 in the waiting line. We have brochures about mycositis, stomatitis, nutrition, psychological support, radiotherapy. Next slide, please. We have also, we overlook the cytotoxic chemotherapy checklist. It's about burden of nausea, vomiting, pain, neuropathic pain, fatigue, all these things. Also a checklist about immunotherapy, the skin rash, you have diarrhea or constipation, also the target therapy, very important, the skin rash, the diarrhea, and all the burdens they have. So we speak about the possible adverse events plus the treatment. We took the parameters, the tension, the oxygen saturation, weight, heart rate, and so. And we give information about the effect of the therapy. We answer questions, we interpret the result of the blood analysis, can they get their administration of the therapy, and we plan next consultations and therapy. Next slide, please. The consultation hour with the oral therapy is also following on the doctor's consultation, also 30 minutes at an hour, also the parameters. We make attention for the therapy compliance, how we deal with the patient, how with you will you want you to take your drugs. We check interactions with other drugs. Some drugs refer with the metabolism, very important to say that they may not use grapefruits. We give the patients at the first consultation a kit with a skin rash. It's very important that they hydrate their skin to avoid lesions. We speak about the possible adverse events and we give tips like hydration, what to do with diarrhea and so. So again, information support, answer questions, and planning the following consultations, plus the CT scan, thorax and upper abdomen after 3 months. Next slide, please. We have also phone consultation hour in the after the morning. We answer questions and needs. Yes. Next slide. And then the additional consultation moments, we have every week multidisciplinary oncologic consultations with all the parts of for diagnosis. We have psychosocial consultation also every week. We speak about the patients who come next week. We speak about the problems and so. We prepare our nurse consultations with the physicians. And in the afternoon, we visit the hospitalized patients. Yes, next slide, please. We participate in a multidisciplinary team with the physicians, the nursing at bedside, the social nursing, the psychologists, nutrition team, palliative team, data managers, collaboration also with pharmaceutical companies. And we help also with some projects. Like now we want to implement PROMs and PREMs. The patient-reported outcomes. We will implement that. We will connect the symptoms with a digital system at the hospital. And when we have too much alerts, it's important that the nurse consultants take contact with the patient. But that's the beginning. So there is such a work to do still. But it's very interested, everything. So with the therapies, with the workload and so, it would be good that we can register the PROMs and the PREMs as soon as possible also to win some time also. I think that was it for me.
Thank you so much, Christine. That was great. And I mean, I think all of what you have gone through there as a specific lung cancer nurse consultant and being there as part of the pathway shows what can be achieved. And like a lot of the items you've gone through are things that are coming up as issues within the care pathway. So I do honestly, genuinely believe that if people had more access to specialist lung cancer nurses and navigators, I think it would help to address a lot of the issues that came up. And I have to say, it's great to hear someone talk about a holistic approach, you know, the whole person approach, and recognizing that you're dealing with a human being, because, you know, care has to be person-centered care. Otherwise, we aren't doing our job properly. And I think as well as that, talking about the psychosocial impacts, helping with the coping mechanisms and the self-management of treatment side effects, all of those different types of things are going to make a massive difference to people that are treated where services like yours are available. So thank you so very much for joining us and giving us that perspective. And I think for a lot of us listening to you, we can only keep our fingers crossed and work as hard as we can to get this kind of nursing, specific lung cancer nursing consultant role. That's I've made that very convoluted now, but we, you know, need to work to have that part of our own healthcare systems, because it can make such an amazing difference to the experience of people.
I have also the chance that I work in a university hospital, that I can focus only on lung cancer patients. Okay. That's great, really. Yes.
Yeah. No, absolutely. It does make a massive difference. So thank you so much again, Christine. We are now going to go to our last kind of, I guess, presentation. MEP Clune is an part of the MEP Special Committee on COVID-19 pandemic. She's also a member of the Special Committee on Beating Cancer, which is Becca. MEP Clune can't be here in person with us today as part of our event, and she sends her apologies. But what she has done is she has made a video with some remarks that she'd like to share. And before we play the video, I just want to give a very special mention of thanks to MEP Clune for all the work that she's been doing at the EU Parliament to help promote putting lung cancer on the healthcare agenda, and for the support that she's given around lung cancer screening and all of those different items related to that. So our sincere thanks to MEP Clune for all that she's doing within the lung cancer space at the European level. So Alfonso, if I can ask you to play the message from MEP Clune. Thank you.
Good morning, everyone. My name is Deirdre Clune, and it's my pleasure to conclude these fruitful discussions, although I'm very sorry that I could not be with you today in person. As a member of the Special Committee on Beating Cancer, BECA, which works to address cancer at the EU level, I've seen firsthand how important it is to support researchers, doctors, nurses and social workers in providing real assistance to patients fighting cancer and those who have recovered from it. Our work on cancer treatment at the EU level is not only an expression of our solidarity, but also our responsibility for the well-being of our fellow Europeans. And I assure you that you have my full cooperation in bringing about changes to support lung cancer patients. This event has provided a great opportunity to discuss the improvements needed to detect lung cancer and its subsequent treatment and care. And as outlined in the 7th Lung Cancer Europe report, there are significant delays between patients experiencing symptoms of lung cancer, getting the diagnosis, and then again receiving treatment. As you may be aware, the European Commission has recently adopted a set of recommendations put forward by the BECA Committee, which include screening for lung cancer, along with prostate and gastric cancer. These proposals reflect the latest available scientific developments and evidence and will lead to earlier diagnosis. Some EU countries such as Czech Republic, Croatia and Poland have implemented nationwide screening programmes for lung cancer. However, in order to ensure equitable access to treatment, it is vital that each member state adopt these recommendations as soon as possible. And furthermore, feedback from patient groups has made it apparent that educating health professionals about the early signs of lung cancer is a necessary step. However, we cannot stop at diagnosis. Patients must receive continued support throughout their journey, with clear, understandable information provided about treatment options and the available support services. Again, this is where increased education and cooperation with healthcare professionals is vital. Communication between lung cancer patients and healthcare professions is crucial for effective supportive care. And as outlined in your report, many patients are not receiving complete information. Discussions like those that we're having today are necessary to raise awareness of the challenges faced by lung cancer patients and to implement solutions to provide the detection and treatment of lung cancer. At an EU level, we must encourage our member states to implement a set of concrete measures to strengthen the prevention and treatment of lung cancer. Early detection gives patients the best chance for a successful treatment, so investing in and expanding cancer screening services does save lives. I hope that the rest of your morning proves successful, and I thank you for your time.
So our thanks again to MEP Clune for those closing remarks. And I think she's come across a number of the things that we've already discussed as part of this meeting, whether it's in terms of communication, continued support. We've touched upon lung cancer screening as well, obviously. But of course, the really important thing is that equity and access. We want to ensure that whatever advancements are made or whatever recommendations come out from the EU Council is something that's available to everybody, and it shouldn't depend upon how much money you have in your pocket or where you're living in Europe. So we really have to strive not only for improvements, but that all of these things are equitable access as well. So we're now coming to the Q&A portion of our meeting. Before then, we go on to the summary and call to action. So I am going to be your moderator for this. So if I could ask Christine and Nicolene just to put your camera on, please, if that would be okay. So we do have a question in for you, Christine. So how was the role of the nurse consultant in thoracic oncology established within the Belgian healthcare centres. So how was that something that was incorporated into the care pathway?
I think a few years ago, it's 12, 13 years ago, they got funding from the organization Kom op tegen kanker, the lung cancer committee. So, and then they organize in a university hospital some budget for to accept a few onco nurses. Yes, like that. It was a special funding.
Perfect. And another question for you, Christine, before I go to Nicolene. Another question is, what is the current situation in Europe in terms of nurse consultants within a specific lung cancer role? Is it throughout Europe, or is it only very, like, certain countries that have nurses within this role, or would you be able to speak to a European level?
The Department of Flanders, there are a lot of nurse consultants, but not only for lung cancer. They have also to do the kidney, the breast cancers. I think it's only in university hospitals that we have the chance to focus on lung cancer only. Okay. So I'm always fighting to attend always meetings, congresses, to optimize our knowledge, because it's really from here, from the hospital, from our hospital, that we share our knowledge to the nurses. Yeah. So we have sometimes a meeting with the nurse consultants from Flanders, and then I give a report from the conferences that I followed. Yes.
Mm-hmm. Yeah. So it's great that so many is going on in Belgium, but hopefully we'll see that across the broader European region as well. But of course, funding, yes, and the money to do these things are always an issue. Yes.
Of course, there is a great difference between the university hospitals. There are only 2, 3 in Belgium, and the peripheral hospitals. Yes.
Yes, perfect. Nicolene, a question for you. Is there a key, so you touched upon a lot of different things across your care pathway and a lot of things that need definite improvement, but if there was one key thing from your experience of the pathway, what would that be? Or maybe you would like to give maybe 3 key things that you feel are the priority that needs to be tackled right now without delay.
Yeah, first of all, I think is awareness with GPs. It's one of the most important things, because they mostly are the first person a patient speaks to. And then, of course, it's biomarker testing. This is absolutely crucial to do it, because it is also vital. And of course, information, more information about what is possible, which treatment lines you could choose, what are the advantages and things like that. These are the 3 main points I see which must be fulfilled to improve the situation.
And a second question that's come in for you, Nicolene, is around side effect management, side effect care. Is there anything that you felt, or anywhere you would signpost to, that gives quite good information about that? Or do you feel it's still within kind of those specific online support groups where that information is given? And if that is the case, how can we take the information that's shared within that and translate it into resources that could be used by everybody?
Of course, you can find over different ways information about side effects and the management. First of all, you could go to websites of the pharma companies, and they mostly I think all of them have a telephone number where you could ask questions. This is really helpful. But I'm still a great believer in patient-to-patient communication, because patients are the experts in managing side effects. And they've got a lot of knowledge. They are they really like to help each other. They have really good ideas, and they are well informed in the best case what to do. And I think that there should be more cooperation between patient organizations and doctors and pharma to do the best together to help people manage their side effects.
So it's really kind of that multi-stakeholder collaboration, co-creation.
Definitely.
Yeah, absolutely. And I think that's something that we need to do more of in terms of that multi-stakeholder group. So I'm just going to take one last question in the interest of time. So that's to you, Christine. And the question is around what type of prompts do you use, or are you going to use, because you mentioned about incorporating that within your setting in your clinic, proms and prems. You're on mute, Christine.
Excuse me. I think we will use the prompts from Isham, but we have still to develop them still, because it's a difference between the oral therapy, the chemotherapy, and so we have to develop this still. Yes.
Okay.
And I want to say what Nicoline says, it's really true. We can learn such a lot of information about the patients, especially from the oral therapy who is new, the side effects. Yes, it's very important that we have these nurse consultations, because when I give lessons, I have also information about these patients that I can share, really. Yes.
Yeah, fantastic. Okay, well, thank you both so much for answering those questions, and thanks to our audience for submitting them. So Alfonso in Mission Control, we're coming to sort of the end, the last couple of slides. And again, you're stuck with me. So this is just going to be a little bit of a sum up and then the call to action from our report before I close out the meeting. So Alfonso, if you go to the next slide, please. So I do apologize. I know in this summary slides are supposed to be to the point, but here what I have done is I've included some of the things that came in as part of this report and some of the responses from our participants. And I think a number of the points here that we can see again reflects that need for support and communication, so that there's one point of contact, being aware of the supports available, listening, taking the person's opinion on board, and communication in languages that people can understand and that things are performed in a short time. So it's the key information needs, the communication, the point of contact, but of course that rapid access to care as well. So if you go to the next slide, please, Alfonso. So when we think of the report that we've created, and again, as I say, I've only given you a flavor here, but we have identified a number of issues in the diagnostic pathway, the treatment part of the pathway, and the supportive care and follow-up. So there's a number of different things here that really need to be addressed. I mean, I think probably what we're going to have to do is look at it, prioritize, and like Nicoline has said, in terms of the education, awareness, and information, and start chipping away at those issues that come up. Because obviously, when you look at how long the pathway can be, how complicated it can be, you know, it can be a little bit difficult to try and do everything at one time. So I think definitely from a Lung Cancer Europe perspective, what we need to do now is look at that and work out ways in where we can chip away at those different issues to try and make improvements. And as we've already mentioned about forming those multi-stakeholder collaborative groups as well, because really working together is when we are going to be stronger. If you click next. So I think overall from this report, I think the summary can really be put into, excuse me, a sentence or so. It's the stressing the need of person-centered models, and these models must be there to improve partnership between individuals and their healthcare providers, and that covers all of the different forms in which this may take. So we need to make sure that when we talk about person-centered care, shared decision-making, person-centered models, that these are not text on a page that's put on a shelf or stored in a file on a computer or a tick box exercise. We need to ensure they are things that are being actively looked at, integrated within the delivery of healthcare, because at the end of the day, you want these things to be available in the real world. And we often talk about real world data, but we need these things to be available in the real world because we know that they can really help to improve quality of life and outcomes for people with this disease. So when we look at the next slide, Alfonso. So as part of this 7th report, we do have a number of materials available, and they're all available on the website. We have the full report, which is in English. We also have a press release associated with it, an executive summary. We have 3 different infographics around diagnosis, information, and support. And a number of these materials are available in 17 languages. And if you just click again, Alfonso. So one of the things we don't currently have available is individual specific country cards for the report, but this is something that we have received a lot of feedback on. So into 2023, we are going to start developing those. So we will have country cards for a number of different countries. And this is something then that we want to add to our report materials moving forward as well. Next, please, Alfonso. So I want to sum up before we close our call to action. So really our call to action falls into 3 key areas. The first is the implementation of rapid referral pathways, because we need to reduce the time between diagnosis and treatment for people with suspected lung cancer. And these need to be organized and coordinated in such a way that they work for everybody and that access is as timely as it possibly can be. Next, Alfonso. We also need to develop targeted screening programs to aid in the earlier diagnosis of lung cancer. So we need to see that stage shift from early stage disease to that of earlier stage lung cancer. And we all are waiting for those EU Council recommendations on cancer screening to come out. But I'd urge any of you who have any interest or any time to work within this area to really make a strong call for lung cancer screening in your country and help with the implementation of that as well, because it's something that could make a massive difference to our community. And again, this is something we all need to come together and work on and have a strong, consistent voice around the importance and value of lung cancer screening for people at risk of this disease. And then our third one, if you can click again, Alfonso. And I promise, Alfonso, the next time I'll try not to have animations, is around the information needs. So we've talked about information a number of times throughout today's event, but it's around providing more information to people impacted by lung cancer, which will help with shared decision-making and improving quality of life through the self-management of disease symptoms as well as side effects of treatments. So really, this has to be a two-way street as well, where healthcare teams need to be in a position to offer comprehensive but understandable information about lung cancer and the treatments available, and also obviously be able to include information there around guidance and management of side effects and reducing risk of complication as well. So that is our 3 key call to actions. And before I close off the meeting, if you go to the next slide, please, Alfonso. I just want to give a couple of thank yous. So I want to really thank all of our working group members. All of our working group members are named within the report. I'm just a little bit too nervous to start naming in case I miss someone, and I really, really, really do not want to do that. But this would not be possible without the support of our working group members. And huge thanks to Diego in particular for really helping to drive this, and for Alfonso for helping project manage this 7th report. And of course as well to Alfonso and Mission Control today to make sure everything has worked very smoothly. So huge thanks to you, Alfonso. and also to thank all of the board as well for all of their input and support of the 7th report. And also huge thanks to Maeve and to Tammy and to Maxima, our new communications company as well, for all the work they have done around this. So I really hope I haven't forgotten anyone there. I do apologize. I know I hadn't time to go through the case studies for the Netherlands or from Romania, but this is all part of our report. And I just want to thank all of the experts from both of those countries who helped. I want to give a particular mention to Meryl Hennick and Elena Comnescu, who really helped to drive this within their countries. And without them, we wouldn't have been able to do those case studies either. So huge thanks to Meryl and Elena as well. I want to thank all of our member organizations. We currently have 38 member organizations in 23 European countries. Thank you for supporting LuCE. Thank you for supporting this report, disseminating amongst your networks. Without you, we would not have been able to get as many participants as we were able to do with this report. Of course, in order to do anything, we need funding behind us. So I'd also like to say a huge thank you to all of our supporters who help fund the activities of our organization and help us to develop and drive patient-driven research, because it can really, really make a difference, and it can really help in terms of forming advocacy tools, not just at a European level, but a national level as well. I also want to give my sincere thanks on behalf of the board to MEP Sokol and MEP Clune for being part of our event, and in particular to MEP Sokol for hosting us and being here with us today. And also thanks to MEP Clune for all of her support and her video. I would also like to thank the European Lung Foundation, the European Respiratory Society, and the MEP Lung Health Group for all of their support they have given to LuCE as well, and have given to this this report and the report launch, and helping us with all of the different things we had to do to get today off the ground and get it as successful as it has been. So if there's anyone else there that I've forgotten, I sincerely apologize, but to anyone who has had any role to play in this, really sincere and heartfelt thanks to all of you, because without everybody working together, we would be unable to do projects such as this. And huge thanks to all of those who participated as well within our survey. So with that, there's one last slide, which is the thank you. So thank you all for joining us, being here for our event. As I've said, all of the report materials are going to be available on our website. That will also include a recording of this video as well. And Alfonso is just going to get the slide up now. You can either go to the website to access the materials directly, or you can scan the QR code as well to access the report. And I also just want to say, before I let you go, huge thanks again to Nicolene and to Christine for being here and giving their wonderful talks as well. So with that, I will wish you a very good rest of your Thursday, and thank you so much again for joining us. We really, really appreciate it, and we hope to see you in person in November at the EU Parliament in 2023.